Hi everyone, welcome to the Healthy Lung. November marks Lung Cancer Awareness Month. So I'm going to talk to you a few words about what is lung cancer. Cancer occurs when cells in the lung, they grow abnormally and out of control, and then they end up forming tumors. Lung cancer is the leading cause of cancer-related death worldwide, and the most common cause being smoking. Cancer in its early stages often does not produce symptoms, but early diagnosis and treatment is of utmost importance to ensure the best outcome. Lung cancer has many ways of treatment which can include surgery, radiation, or chemotherapy. One might want to know what are the causes of lung cancer. So like I said, smoking is the most common cause of lung cancer, be it cigarettes or BD or the other non-smoke forms such as gutka, pan and other Indianized versions too. Sometimes exposure to second-hand smoke, that is smoke which comes out of the burning end of a cigarette when someone else smokes. If you inhale a lot of second-hand smoke, that too can result in lung cancer. Certain industrial chemicals and noxious gases and particles increase the risk of lung cancer. However, having said that, people who have never smoked can also develop lung cancer. The types of lung cancer have been classified into two major categories. One is called as the non-small cell cancer and the second one is called as the small cell cancer. The small cell cancer is perhaps the fastest growing type of lung cancer. It's very aggressive and can spread quickly to other parts of the body such as the brain, the liver and the bones. And it can also cause large tumors, and smoking is almost always associated with the small cell type of lung cancer. The non-small cell type of lung cancer is further divided into various other types such as adenocarcinomas and squamous cell carcinomas and large cell carcinomas. Symptoms and signs of lung cancer. Lung cancer often may not cause any symptoms or signs earlier on, or they may be very minimal and go off unnoticed. Most often what patients note is that there may be a new onset of cough that does not go away easily, or it may just be the worsening of a chronic cough, such as a smoker's cough. Sometimes people cough up blood in the form of blood streaking of sputum or even sometimes frank blood. Many people develop pneumonia or a bronchitis which may occur just for the first time or may occur repeatedly. There may be changes in the way you breathe. You may have an undue awareness and become breathless. You may develop wheezing. Some people develop chest pain on the side of lung cancer. They may lose weight without actually meaning to, and they may also suffer from loss of appetite. Some people feel tired all the time. The less common signs include difficulty in swallowing, a change in the voice such as a hoarse voice, a back pain or a joint pain. Sometimes there may be weakness or facial swelling, drooping or paralysis of either of the limbs. The doctors who treat such symptoms are called as pulmonologists or chest physicians. They deal with the respiratory system. So once you go with these symptoms to your pulmonologist, what happens? Most often they begin to talk to you and listen to your history and also conduct a physical examination and sometimes some tests. If you are a smoker or have smoked any time in the past, or if you have any of the risk factors or causative reasons that I had mentioned earlier, you should tell your doctor. The doctor will listen to your lungs with a stethoscope while you breathe. Following that, very often their pulmonary function tests or tests of breathing are performed. Sometimes your sputum may be tested for infection or to see if there are any cancer cells there. Pictures of your lungs are taken in the form of chest x-rays and sometimes CT or computerized tomography scans. They help to diagnose lung cancer. Sometimes a bronchoscopy may be advised. It is the insertion of a thin fiber optic tube through your windpipe or the trachea, it goes into the lungs. This bronchoscope has a small camera at its end through which we can visualize what's going on inside. Sometimes a thoracoscope, which is again a small tube which is inserted through the side of the chest to look for the lining inside. A biopsy may be taken of the tissues or the fluids inside your lungs to examine the cells for cancer. This helps in confirming or refuting the diagnosis, and if a diagnosis of lung cancer is made, we can use it to identify the type of lung cancer. So once the lung cancer is diagnosed, what happens next is that a classification stage is given. This stage describes what type of cancer you have and whether it has spread to any other part of the body. Any cancer that is spread from its original site to any other part of the body is called as a metastatic cancer. So that is called as staging. What about the treatment? The type of treatment received depends on several factors such as the type and whether it has metastasized. It also depends on the size of the tumor. It helps in reducing the size, preventing the cancer from spreading, or sometimes rarely curing the cancer too. Small cell lung cancers respond well to radiation therapy and chemotherapy, while the non-small cell lung cancer benefit with surgery either of a part of the lung or the whole lung, or sometimes the surgery may be followed by chemotherapy or radiation therapy. Chemotherapy is giving a series of cancer-fighting drugs over a period of time. There are several types of radiation therapy such as external beam radiation, intensity modulated radiation, image guided, and stereotactic radiosurgery or stereotactic radiosurgery. Radiation therapy is basically a painless procedure. The radiation oncologist is the person who prescribes how much you need it and for how long. So it's usually given over a period of time. Rather than doing all these things, it's important that we recognize the signs and symptoms and the causative factors and try to prevent it. Smoking, like I said, causes most types of lung cancer. So try to quit smoking. If it is difficult for you, approach your pulmonologist or your chest physician who can help you in counseling or giving you medicines to help you quit smoking. Avoid any kind of secondhand smoke. Make sure that you follow safe work practices at your workplace too. Are you at risk? If you feel that you are at risk, please do contact your chest physician or pulmonologist immediately. A last point that I want to mention are the complications of lung cancer. The most common complication is that lung cancer spreads to the other parts of the body, such as the brain, the bones, the lymph nodes, or the liver. Some cancers spread quickly, and some will come back after it has been treated. With that, I conclude this short talk on types of lung cancer, the treatment, and the symptoms. Please watch this space for more information regarding respiratory disorders. Stay safe. Thank you.